Everybody, welcome in A to Z Sports, a DocTalk segment. We love doing these because we've got great guests that join us from the Bone and Joint Institute, boneandjointtn.org. That is their website. They've got over a dozen physicians there in Franklin who specialize in really anything that can go wrong with the human body. And today, because we're talking about feet with Carson Wentz and Quentin Nelson, both of the Indianapolis Colts, we bring in Dr. Jeff Watson, who is a foot and ankle specialist. So we'll get the down low on really the craziness of the same injury happening with teammates in the same week and how wild that is. But once again, DocTalk is presented here on A to Z Sports by the Bone and Joint Institute, boneandjointtn.org. That is where to go to get their services. They streamline it and make it easy for you because you're the one who's hurt. You're the one who's trying to get healthy, so they don't want to add on to the difficulty of that. But Dr. Watson, thanks for jumping on here. How are you doing today?
Guys, thanks so much for having me. Appreciate you making a window for me.
Yeah, no problem. So how rare is this, weird is this, that two teammates have the same type of injury and the same type of surgery in the same week?
I mean, it's just not common. I mean, I think the surgery that Carson has, really both of them, but removing that extra bone or either an old fracture or congenital thing like Quentin Nelson, that's something that happens probably once every 5 years. Pretty rare thing. And so normally we talk about Jones fractures. That's a lot more common. Like Julio Jones had that fracture of the same bone, the fifth metatarsal, or Kevin Durant. That's a much more common injury you may have heard of.
So you mentioned the difference in the Carson Wentz injury and the Quentin Nelson, where Quentin Nelson was apparently born with this. Take us through how that can happen. Like, how are you just born with this injury?
Well, I guess to better understand what's going on there too, the fifth metatarsal is the bone on the outside of the foot, and it has a tendon called the peroneus brevis that's attached to it. And that helps to pull your foot to the side, balance your foot on uneven ground. And so where Carson Wentz turned his foot and had an avulsion fracture, like pulled a little piece of bone off with the tendon back in high school and then re-aggravated that. Quentin Nelson was probably born with having a little extra bone there, and it didn't ever grow back as one bone when he was a kid. And then so he just re-injured that kind of scar tissue that was in between the two bones. And that's why it's a little bit different, but essentially the same treatment option. You're removing a bone and then you're advancing the tendon back up to the main bone. You usually put a suture anchor that kind of pulls the tendon back down to the bone, if that makes sense.
Yeah, you kind of dove into that a little bit, but how usually does this injury, whether it gets re-aggravated or kind of from the beginning it happens, is this, you mentioned like maybe the turn of an ankle or turn of a foot, or can somebody step on your foot? What have you seen maybe in the history of looking at this type of injury on how it occurs?
Yeah, it's the same kind of mechanism as an ankle sprain, where you would invert or turn your ankle. That same force can actually pull the bone off, usually with the tendon. But to re-aggravate it like that's extremely rare. I mean, usually these fractures, even if you do have them on the outside of your foot, typically do well, don't need surgery. Almost 95+% of the time, it's pretty rare to have to go back in and remove that little piece of bone.
So we know Carson Wentz was kind of thinking about it for a few days. Do I need to go ahead and have the surgery now, or can this heal on its own? What are some things you're looking for in maybe the few days after the injury occurs to determine whether or not surgery is necessary for the athlete?
So in these things, we always think about what's the long-term effect. Is this something we can sort of, protect you and get you back out there? Or is this something that's going to really ruin your foot for long-term? And, with that injury, it's something that, if he were able to kind of functionally go and he could kind of manage his pain better, he might be able to play through it. But it just seems like after a few days, he wasn't really tolerating it. He was going to be out anyway. So might as well take care of the problem and just rehab one time, shorter period of time out, and get him back out there.
So speaking of that surgery, what is the risk of surgery, right? So we as non-doctors, I always look at the foot as being like, there is so many different bones within the foot. You don't want to mess with the foot, right? And so what is this type of procedure as far as the caution level, or just going in there and the risk of something that could possibly go wrong or possible complications?
Yeah, it is still surgery, right? There can always be a complication. So, always try to avoid surgery if you can. And you're right, the foot's the foundation. You can really mess up the foundation and slow somebody down. It matters a lot more in somebody who's like a speed athlete, running back, cornerback, wide receiver. I mean, because you're reattaching that tendon back down to the bone. And so that's the risk, is that tendon can pull back off the bone, and then you'd potentially have to go back to another surgery. So it could get infected. That's also an issue, but that's a relatively low occurrence. For the most part, it's generally a pretty safe procedure, high rate of getting you back out there. And I think that's sort of the reason for the gap in terms of, I think they said like 5 weeks to 12 weeks.
Yeah.
It sort of depends on, what kind of player you are. And I think, Carson's mainly, first he was kind of running quarterback. He's pretty much a pocket quarterback for the most part now, I think. And so he's not scrambling nearly as much as he used to. And so, with him not having to do that high torque speed, the same with Quentin Nelson, he's kind of pretty stationary. You can get those back a little sooner. That's probably more like the 5 to 6 week mark. Whereas somebody who's really doing a lot of cutting activities and side to side jukes and things like that, that's gonna be a little bit longer.
Well, so it sounds like this is more maybe about the tendon, right? Is it more of a tendon healing process than anything else?
I mean, it's exactly right. I mean, the tendon probably is the bone is what's causing the pain, but to get back, it's the tendon. So really you're just trying to prevent that from re-rupturing or tearing off the bone and just getting that to heal. And you can kind of tell from what the surgery is, you're removing the bone. You don't have to have that. So it is something that's expendable.
A to Z Sports Doc Talk presented by the Bone and Joint Institute. Here joined by foot and ankle specialist Dr. Jeff Watson from Franklin at the Bone and Joint Institute. So with this window, like we've talked about, the 5 to 12 weeks, which Mike Vrabel, Titans head coach, laughed at and said, well, I guess you have a pretty good chance of being right, landing in that 7-week period. But when it comes to these two players, let's start with Carson Wentz, then we'll go to Quentin Nelson. You've already kind of touched some on it, but what's the primary objective right after surgery to get that rehab started? What's the first thing you're looking to accomplish with a quarterback style athlete after this surgery?
So a few things there, big things get the incision to heal. Once that heals, you can really push motion and push strengthening at that point. Now it's usually gentle strengthening for about 6 weeks. Once you get to the 6-week mark, that's when you can pretty safely say the tendon's probably healed back pretty well to the bone. Some interesting things that have come about with Tua Tagovailoa when he had his ankle issue that was pretty interesting is they've started putting these accelerometers on the back of the players' pads. And so you can tell how fast the player goes forward, backwards, side to side, and it kind of makes a little diamond shape for you. And so one of the things they try to figure out when to push him back, because he went back super early compared to what our most of our protocols are. They actually waited until he matched that same acceleration that he had prior to surgery, which I thought was a really interesting way of getting back to it, which I think that's probably becoming more in vogue with the different NFL teams. I don't know specifically about the Colts, but I think that's some pretty neat technology that's coming about. So I think that's something they could use to help to get him back sooner, potentially, depending on how he's doing.
Yeah, I feel like that. I mean, that's the new evolution of modern medicine, right? We talk about ACL tears and how they are not like they used to be and how quick people can recover from that. When you talk about the, post-surgery, they're going to be in a boot for a certain amount of weeks. Is this what's that process? I'm fascinated with when they can walk, when they can run, when they can sprint. And, you talk about the 12-week mark, right? That's a little bit of the longer. Would that be if there was complications or setbacks? Is that more of that timetable?
I think that 12-week time part is more about a more of a speed athlete when they're doing those cutting activities. If he's mainly side to side motion, just pretty minimal, and you can tape up his ankle and really support that. Essentially you're going to be protecting us kind of like an ankle sprain would with an ankle brace or taping his ankle significantly to prevent it from going side to side. So that's kind of a big piece of protection there. If he I guess another question you had was about
like right after
rehab.
surgery. Yeah,
so right after surgery, they probably put him in a splint for a couple of weeks to let the incision heal, then likely move him to a boot, and then he could put weight on it. Usually you're starting rehab between the 4 to 6 week mark with most patients, and usually athletes, you can push them a little bit sooner just because their pain tolerance is a little different than most.
So the tendon is the most important part of the healing process, right? To make sure that's there. And so when you just said there, it may be the 3rd or 4th week to start the rehab process. When you have this injury and you're a quarterback where you don't have to have a ton of cardiovascular health, but you still need to do that. What are some things you can do to keep that up so you're just not, sitting on the couch like any of us would do while you're waiting for this thing to heal?
Yeah, there's a lot of things that have come about too. So you have of course, biking, elliptical. Those are less impact activities that don't do a lot of side to side motion. You can get away with, and there's been some advancements in terms of gravity assisted treadmills where you can actually dial in the percentage of body weight you want a player to have, and then say 50% weight bearing on this, so he doesn't see as much stress on his ankle, but allow him to do some cardio.
I got one more question. It is a pan personal. So Dr. Thomas, who's at the Bone and Joint Institute, he looked at my foot. I have a bone spur on my big toe. I played basketball for years.
Yeah.
And so I'm probably going to have to get that removed. So Doc, shoot me straight.
Yeah.
What would you rather have, a bone spur removed on a big toe, or this injury that Quentin Nelson and Carson Wentz are dealing with?
You'd rather have that bone spur. I mean, we can shave that peppy off and have you back on the basketball court in no time. Yeah, you'd rather have that bone spur.
I do have a question because, even if Zach's playing hoops, his foot's going to get stepped on. If you're Quentin Nelson, if you're Carson Wentz, a lot of times your feet are in traffic. And is that a concern?
That's a real concern.
Because it's a cleat, right? It's not just a heavy foot, but a cleat. And then maybe if somebody steps directly on that incision, directly on the tendon once again, then I would think it's pretty likely. How do you protect against that?
Yeah, rolling the ankle is basically the issue there. That mechanism of turning your foot to the inside could potentially pull that tendon off the bone, and so that's why it's important to give it that 6 weeks to heal. The chances of it re-rupturing at that point are very low, but that's why God, these guys are huge, right? There's a lot of force going through those ankles. So, taping it up, ankle brace if you can, cleats that go above the ankle, all those things help to decrease your chance of, even if you get stepped on, preventing that from being a problem.
So last thing for me, and I don't want to put you on the spot too much, but the 5 to 12 week window, you've said 6 weeks a lot during this conversation. What would be a general comfort level for you to have to see an athlete, a quarterback, Carson Wentz, playing in a game? How many weeks after this surgery before where you're not cringing? Because if they push it and you're the surgeon and it's like week 5 and he's out there for week 1, you're probably cringing a little bit. What's that week where you're not cringing to see him out there?
Oh, I think the end of the season, right? I mean,
if you're a Titans fan, you're thinking into the season.
You love to hear that if you're a Titans fan.
Yeah. Just anytime you operate on a player, your name's on that patient. So you want them to do well. You don't want them to have any problems, and just until the season's over, you're just kind of watching. Just every move. It's a different way to watch a game for sure.
Yeah, I don't envy that. But no, appreciate the insight. I think it was very interesting. But the fact that this happened to these two teammates in the same week is pretty crazy. But Bone and Joint Institute, boneandjointtn.org. Again, turn to them whenever something might happen, whether it's a bone spur in your toe or you roll your ankle, taking out the trash, whatever it might be. They've got you covered. Dr. Jeff Watson, a foot and ankle specialist there in Franklin at the Bone and Joint Institute. Thanks for your time again today. And who knows? Somebody might hurt a foot later on, and we'll be talking to you again this season.
Hey Zach, I want to see you out there next week. Let's do it.
I know. You gave me hope. This is great. An insurance-free diagnosis of the. This is the kind of stuff that Bone and Joint Institute. This is why we love them.
Perfect. Hey, Austin, Zach, thanks so much for having me on. You have a good day.
Appreciate it. Thanks, guys.